7 Herbs, Prostate, from Practice. A story about herbs recommended in accordance with the Rambam tincture method for a person with prostate disease and moderate alcohol consumption. A story based on expedition diaries. Prostate diseases are a common problem among middle-aged and elderly men, requiring a comprehensive approach to treatment and prevention. Along with traditional methods of therapy, Jewish traditional medicine recommends using medicinal plants for the Rambam tincture to support health. In this story, as an example, 7 herbs are considered, traditionally and modernly recommended in accordance with the Rambam tincture method to support prostate function, and their safety for people who periodically consume alcohol is analyzed. 1. Saw palmetto, Serenoa repens. Serenoa repens is one of the most well-known herbs for supporting the prostate, especially with benign hyperplasia, BPH. The active components of the extract, fatty acids and phytosterols, are able to inhibit 5-alpha reductase, an enzyme that converts testosterone into a form that promotes prostate growth. Clinical studies have shown that saw palmetto can reduce the urge to urinate at night, relieve symptoms of BPH, and do not affect the level of prostate-specific antigen, PSA. Moderate alcohol consumption does not interfere with the action of saw palmetto, but when combined with alcohol and medications, side effects such as headache or dyspepsia are possible. Consultation with a doctor and monitoring of liver function are recommended. 2. Stinging nettle, Urtica dioica. Nettle root contains lignans, phytosterols, and polysaccharides that can reduce inflammation associated with prostate disease. Nettle is useful for chronic prostatitis and BPH, has a mild diuretic effect. Nettle root extracts slow down the growth of prostate cells and affect hormone levels. In combination with alcohol, nettle does not exhibit a pronounced toxic effect, but can increase diuresis, which requires caution when drinking alcoholic beverages. 3. Tansy, Tanacetum vulgar. Tansy is a well-known plant with antiseptic, anti-inflammatory, and antispasmodic properties. Some components of tansy, such as thujone, can affect the smooth muscles of the genitourinary system, relieving discomfort associated with prostatitis. It should be noted that thujone can be toxic if the dosage is exceeded, especially in combination with alcohol, which increases the load on the liver. When using tansy, it is necessary to strictly adhere to the recommended dosages and take into account individual characteristics. 4. Burdock, Archeum lapa. Burdock root is rich in inulin, essential oils, and antioxidants. It helps to normalize metabolism, has a mild diuretic and anti-inflammatory effect. It is used in herbal mixtures to support prostate function, improve drainage, and relieve swelling. Burdock practically does not interact with alcohol, but its diuretic effect can be enhanced by the simultaneous use of alcoholic beverages. 5. Echinacea purpurea. Echinacea is a classic immunomodulatory agent that helps reduce inflammation and strengthen the body's defenses. A number of studies have noted the positive effect of echinacea on chronic prostatitis due to the stimulation of phagocytosis and regulation of cytokines. Echinacea remains safe with moderate alcohol consumption, but excessive amounts of alcohol can reduce the immune response and the effectiveness of herbal medicine. 6. Solidago canadensis. Goldenrod is a well-known diuretic and anti-inflammatory plant, often used for diseases of the urinary tract and prostate. Flavonoids and saponins of goldenrod help improve urination, reduce swelling and pain. Goldenrod is compatible with moderate alcohol consumption, but its use requires caution in the presence of impaired renal function. 7. Lespedisia capitata. Lespedisia is a lesser-known but promising herb with pronounced anti-inflammatory and mild diuretic effects. It is used to reduce congestion in the prostate, improve overall well-being, and reduce the risk of complications. Lespedisia does not cause significant negative effects when combined with alcohol, but it is worth remembering the possible increase in diuresis. An integrated approach and modern scientific data. The use of the 7 herbs of the God's pharmacy to support prostate health should be based on the principles of safety and an individual approach. Modern clinical studies confirm the effectiveness of most of the listed plants in mild and moderate forms of prostatitis and BPH, benign prostate hyperplasia. It is important to remember that herbal medicine does not replace medical intervention, especially in cases of an infectious process or suspected cancer. Occasional alcohol consumption requires additional caution. Alcohol can increase the side effects of some herbs, reduce the bioavailability of active components, and also increase the load on the liver and kidneys. You should limit alcohol consumption, strictly adhere to the recommended dosages and conduct regular health monitoring. Practical recommendations. Before starting a course of herbal therapy, you must consult a urologist. All plants should be used only in approved, tested dosages. A preference should be given to certified products and official herbal preparations. A moderate alcohol consumption is acceptable, but only if there are no contraindications from the liver and kidneys. It is not recommended to combine herbs and alcoholic beverages in one day. Regularly monitor your condition. Pay attention to any side effects. Conclusion. Jewish traditional medicine offers a wide range of means to support prostate health, especially in cases where a person leads a normal lifestyle and does not deny himself moderate alcohol consumption. The 7 herbs considered, saw palmetto, stinging nettle, tansy, burdock, purple echinacea, Canadian goldenrod and Lespedisia capitata, have proven efficacy and safety when used correctly. However, the optimal approach always requires taking into account individual characteristics, consultation with a specialist, and an integrated approach to therapy.